Hello guys, let's move towards the management of appendicitis. Since we have learned already the anatomy of appendix and the clinical features related to it, now we should know that diagnosis is also very important because there is certain management linked to the diagnosis of appendicitis. So as you all know that appendicitis is essentially a clinical diagnosis, and for that there is a scoring system called as Alvarado score, that is also called Mentrals. And Mentrals is the short form for migratory pain, anorexia, nausea, tenderness, nausea and or vomiting, tenderness, rebound tenderness, elevated temperature, leukocytosis, and shift to left. Shift to left means increased number of neutrophils. So everything is having scoring of 1 except tenderness and the leukocytosis. So tenderness carries the 2 number and the leukocytosis carries the 2, and the total scoring, if you say, is 10. And if a patient is having the scoring of 1 to 4, the diagnosis of appendicitis is less likely. You can think about other diagnosis. And if it is 5 to 6, it is equivocal. You can get some investigations done to confirm the diagnosis. If it is 7 to 8, there are more likelihood of having the patient appendicitis. If it is 9 to 10, it is almost certain that the patient is having appendicitis. So if the patient is child, the clinical history is difficult to elicit, you can get the ultrasound done in that patient. If the patient is adult, you should go for the CCT abdomen. Now, what are the ultrasonographic findings in a patient you are referring for a USG suspecting appendicitis? We traditionally get the report as elongated blind-headed tubular structure, non-compressible with diameter more than 6 millimeter, and there is probe tenderness. In addition to that, you can get there is free fluid surrounding the appendix, there is inflamed surrounding mobile lobes, there is lymphadenopathy, and there is increased blood supply which can give rise of appearance of ring of fire, and there can be thickened appendiceal wall. So if you have diagnosed the patient as having appendicitis, what should you do? So in simple clinical or diagnosed with ultrasound or CCT uncomplicated appendicitis, you can go for appendectomy, which can be through laparoscopic or open method. If there is a lump formation at the time of your diagnosis, you should follow a regime called as Ochsner Sherren regime. I'll explain in the next video. If there is complicated appendicitis or the abscess, if you think that it is an abscess, you should drain it, and it should be USG guided or CT guided. And you can also go for non-operative management at that time. And after the patient is managed, you can go for the interval appendectomy. Okay, thank you so much. We'll meet next.